So today we're going to be doing the scenario 4 for rugby. So pretty much first things first, I'm going to ask for permission. So is it okay if we do these tests today?
Yes.
Beautiful. So pretty much the scenario is saying that he injured his left knee and his right elbow. So first things first, we're going to do active range of motion, and this is just to see, we want to see his willingness to move. We're going to note the pain, and we want to also compare bilaterally the ranges of motion. So first things first, we're going to start with his uninjured leg first. I'm going to ask you, bring your heel towards your bum, noting that range. Beautiful. Any pain with that?
Nope.
Okay, so now I'm going to ask him to extend. You're going to extend your leg. So now I'm going to ask you to contract the quad, bring that heel off towards the ceiling. Beautiful. Noting that, noting the range. Any pain with that?
Nope.
Perfect. Now we're going to go to the injured side. So same thing. I'm going to ask you, bring your heel towards your bum. Any pain with that?
Nope.
Seeing this range is a little bit off, but nothing too crazy. Now I'm going to ask you again, extend. You're going to contract the front, bring your heel up. Any pain with that?
Nope.
Perfect. So now we're going to rest. Now we're going to do internal, external rotation. Still doing active. He's doing it all by himself. So I'm going to ask you to bend your knee, point your toes towards the ceiling. Can you bring your toe towards that wall? Any pain with that? And we're seeing how much range he's getting. So now I'm going to ask you to point towards that wall. Seeing that range. Any pain with that?
Nope.
Perfect. So now we're going to do the other side so you can rest. So bend that knee, point that toe up. You can bend it just a little bit less, 90 degrees. Point that toe towards that wall. So that's internal rotation. And now you're going to point out. And that's external rotation. Perfect. No pain with that?
Nope.
Now you can rest. Now we're going to be doing passive range of motion. And pretty much this is to see the contractile, the non-contractile tissues and the joint capsule. We really want to stretch. See how we're going to note the end feel and if there's any pain with that. And also compare the difference. So pretty much first, we're going to do this side first because it's his non-injured side. I'm going to bend the leg and I'm going to push in towards. So noting that end feel, which is soft, that's tissue approximation because the calf is hitting the back of the leg. Beautiful. Now for this one, we're going to extend, pulling up, pushing down on the, pulling up on the heel, pushing down on the quad. And that is, we feel that stretch in the back, but also the bony block from the knee. Beautiful. Any pain with those?
Nope.
Okay, so now we're going to do this side. So again, bending, bringing it in towards, feeling that soft tissue approximation, not being able to go because of his thigh. Now going back into extension, pushing on that knee, pulling up. Any pain with that?
Nope. Again,
Noting that joint capsular bony block and that stretch in the back. Now we're going to do internal and external rotation. Passive, again, he's going to be resting. I'm going to bend. I'm going to ask him to bend his knee. Point your toe towards. Now you're going to relax. I'm going to cap the back of his ankle. And I'm going to rotate out, which is external rotation. And now rotate in towards the wall. Any pain with that?
Oh.
Beautiful. And again, the end feel felt hard. There's no laxicity, which is good. Now I'm going to do the other side. So bend. Again, 90 degrees. Capping the back of the leg. So we're going out. Any pain with that?
Nope.
And in. Internal rotation. Any pain with that?
No.
Perfect. Now I'm going to ask him to relax. So now that we're done passive, we're going to do resisted. And pretty much for this one, this is going to be testing our contractile tissue, seeing the strength. We're going to test it. We're going to rate it out of 5. 5 means full strength. 3 means only being able to hold it out of gravity. And 1 means pretty much no contraction. All the fibers are torn. So first things first, we're going to do his non-injured leg. You're going to try to bring your heel towards your bum, and I'm going to resist. We're going to hold it for 5. Ready? 1, 2, 3, 4, 5. Any pain with that?
No.
Perfect. So while we're here, we're going to do extension. And that's going to be testing his quads. So you're going to bend this one. We're going to go over like so. I'm completely blocking. And you're going to hold it there, and I'm going to try to push you down.
All right.
And you're not going to let me push you down. Okay? We're going to hold it for 5. 1, 2, 3, 4, 5. So that's 5 out of 5. Complete strength. So now we're going to do the other side. You're going to relax. Relax. So again, we're going to test the hamstring strength first. He's going to try to bring his heel towards his bum. 90 degrees. And pull. 1, 2, 3, 4, 5. So 5 out of 5. No, do you have any pain with that?
No.
Full strength. Bend this knee for me. I'm going to come up like so. You're going to hold it, and you're not going to let me push you down. Okay, so hold it like that, and don't let me push you down. Ready?
Yeah.
1, 2, 3, 4, 5. Any pain with that?
Nope.
Perfect. And that was pretty much the strength of his quads. So now we're going to test his rotators. So first, uninjured, asking you to bend. Going to come here, holding in first because I'm going to test his internal rotation. So I'm going to cat like so, and you're going to try to go inwards. 1, 2, 3, 4, 5. Any pain with that?
Nope.
5 out of 5. Feels like full strength. No pain. Now we're going to do external. So same thing. In a cat. And you're going to try to go out. 1, 2, 3, 4, 5. Any pain with that?
Nope.
Perfect. So now you're going to rest. 5 out of 5. Now we're going to do his injured side. So again, bend, toes up. This one you're going to go in towards that wall because we're doing internal rotation. You can go. 1, 2, 3, 4, 5. 5 out of 5. Any pain with that?
Nope.
Beautiful. Full strength compared to the other. It's the exact same. Now we're going to go out. I'm going to hold this. You're going to try to go out. Go ahead. 1, 2, 3, 4, 5. Any pain with that?
Nope.
Perfect. So now that we're done all of our functionals, we're going to test his meniscus, which is the Epley compression test. So I'm going to ask you to go on your stomach. And because you heard his left leg first, we're going to test his right. So pretty much I'm going to ask you to go to 90 degrees. I'm going to hold his ankle and the foot. I'm going to press to put pressure down, and I'm going to rotate. How does that feel?
Good.
Any pain with that?
No.
So the reason why we're doing that is because the meniscus, usually with injury, it's compression and rotation. So that's why we're pushing and rotating. So now we're going to do his injured side. So again, up to 90 degrees. Holding. Going to push down, really push in, rotate, and rotate immediately. Any pain with that?
Nope.
Beautiful. So again, it looks like his meniscus all intact because he doesn't have any pain, and I'm able to really push down and rotate. Lastly, I'm just going to ask you to sit up, and I'm going to test his UCL, so his ulnar collateral ligament. So pretty much we're going to handshake, but it's your right side. So we're going to do your left first. So we're going to come over here, and I'm going to shake his hand. And because it's his UCL, which is the outside, I'm going to shake his hand, but I'm going to go up. Do you have any pain with that?
Nope.
So I'm feeling that stretch on the outside because that's the UCL. Beautiful. So now I'm going to do the other side. So shake his hand like so. Go up. Again, feeling that stretch. Do you have any pain with that?
Nope.
Perfect. That's our UCL test to test that ligament on the outside, which is all good. No pain. Got complete stretch. So now the answer to both of my questions. So the first question is, sorry, I just have to look, is the quad strain. So what movements are painful? So pretty much for extension, for knee extension, for active, that would be painful because we're testing that strength of that quad. For passive, it would be knee flexion because now we're putting that on stretch. And then for resisted, it would be knee extension again because now we're actually making that quad work and having to go against it. For the second question, the second degree strain, pretty much I was saying it would probably be a 3 out of 5 or below. And the reason for this is because you have a significant amount of fibers torn, but not all of them are torn, which means that you could possibly still have some sort of strength against gravity. However, anything more than just gravity, because some fibers are torn, would probably not be able to happen because, again, it is a second degree strain. Thank you so much.